some people coming in and out, but wanting to be respectful of everyone's time. And I know this is the last talk on a Friday, and after lunch, we didn't know how many people would turn out, so thank you all for being here. And we're hoping to, not just stand up here the whole time. We'll be bringing the mic around. We want this to be interactive. We don't want this to just kind of be a PowerPoint, and we want to, honor that there's probably a lot of expertise in the room and that we can all learn from each other. So we'll have some exercises that we do. We'll have a chance for some experiential exercises like role plays and some discussion questions throughout. So by show of hands, how many trainees are in the room? Okay, thank you, trainees. MFTs, licensed social workers, psychologists, okay, a lot of psychologists, psychiatrists, nurse practitioners, any other group that I missed? Case managers? Okay. And how many of you supervise as part of your work? Okay, so quite a few. So supervision, is something, really important, and for all of us, we were all supervised in order to receive whatever licenses and credentials we have. And for a lot of us, we also feel strongly about being able to give back in that capacity. So here are our learning objectives. So we really, this is borrowed from the Sue and Sue model. We kind of wanted to focus on these three components of diversity competence, and they are awareness, knowledge, and skills. So we have something to try to touch on each of these components to be able to enhance all of our ability to supervise, and then, in turn, our trainees take that to their clients. So we're going to do a little bit of introductions, and our presentation will follow this order, and we'll have a little bit of a chance to debrief. So we'll have some experiential exercises. We'll do a little bit of a review of best practices in the literature and an opportunity to practice. Okay. So a little bit about us. Ellie, you want to sit, stand?
So I'm Ellie Hernandez, and I am a psychology intern at UCLA, and I was actually one of Ayala's supervisees.
Yes. You want to say a little bit about what made you interested in this too?
Oh, sure. Sorry. My dissertation at Teachers College Columbia, and a lot of my work centers around working with undocumented students, but as a result of learning about the model that we're going to be talking about today and working under Ayala, I really didn't really think that there could be a connection with supervision and multiculturalism and a lot of the stuff that I learned at TC. And I really kind of saw it modeled for me, and it got me excited about supervision, and so now I can kind of see myself not just maybe doing some supervision myself, but really, seeing that as a part of the work that I do as a clinician. So
I don't evaluate her anymore, by the way, so I think I don't know that she's worried about monitoring when she says it. I got interested in this during my graduate studies. I was lucky to have some very positive initial supervisory experiences, and I did my dissertation on the Supervisory Alliance, which is one of the most highly researched factors in the supervision literature, but I really wanted to tie it more directly to competence that the trainees have, clinically. And I worked with Carol Fallender and Ed Shafransky on that. They were my mentors, and they come from the competency-based approach, so that was the approach that I was trained in. And it is agnostic, so it could go with, the developmental model, and certainly it's actually developmental model is subsumed under it, and the interpersonal model, and also different theoretical orientations. And I've been doing kind of more work recently with multicultural competence was part of what I looked at in my dissertation research, along with ethics and kind of how to best practices for giving feedback. So it's a little bit about how I got here. So let's see. So first, I just want to start out by talking about the terminology that we use. And I feel like, I don't know, I've been going to a lot of really interesting presentations over the last couple days and really bringing everything to life. And one thing about the competency-based supervision model is we have a lot of really dry language, frankly. It's a bit purposeful because we were trying to match kind of what medicine was doing to measure what we're doing in training. But I just want to point out that there's, something problematic about using the term competence when we're talking about cultural diversity competence. Any ideas about what that is? Not everyone, not all at once, please. Exactly, that it could be something that you would finally attain. So, this is not something that we can, get a check mark that we're done and now we're competent and we've arrived. This is really something that, we're perpetually learning about and growing. So I just want to point that out. We do use the term, cultural competence, even, the title of this conference, and multicultural competence throughout. Okay, so we're gonna, the handout. So we're going to start out with a little bit of an exercise to, thanks, Ellie. Ellie's gonna pass out some handouts. And I'm going to talk a little bit about what we want you to do. This is going to be just an individual exercise for each of you to do on your own, for your own. And it concerns, for yourself, your dimensions of identity. And by the way, I have to say that before I came down here, I asked, we have really great support staff at UCLA, asked them, for help kind of making these handouts. On some, colorful paper. And when I got them and it was bright red, I was like, oh, this doesn't really encourage self-reflection, for me at least. That's my cultural association with red. I was thinking kind of like a pastel blue or green was more self-reflection promoting. But, see how you do. So what I want you to do is fill in your group membership for each of the group listed. If it's not something you feel like there's a label on, that's okay too. You can leave it blank. And then use the key to say whether it's something that's a very important influence on your beliefs, preferences, and behaviors, somewhat important, not at all important, or you never really thought about it. Does everyone have one? Thanks, Ellie. So I'm going to give you some time to just complete that. And I do want to say that every time I do this, I think of, like 5 other categories that could go on there. It's something I adapted from Dr. Shelley Harrell. Okay. I mean, this is definitely something I think a lot of us can spend a lot of time thinking about. I guess to start, we'll come around with the mic. I'm wondering, any reflections or observations doing this that anybody wants to share? Some things, to think about. One of the reasons we're doing this is because we know that awareness is a part of our own cultural competent practice in our clinical work and supervision and really everything that we do as mental health professionals. Yes.
Hi. So I also went to TC for my master's, so I was very much infused with multicultural teachings and stuff like that. So I know that if I were to have done this back then, I would probably have a lot more X's and question marks. But now that I've been infused with all this multicultural teachings and just like becoming more aware of all the different identities and stuff like that, it's really opened it up. So I have a lot more exclamation marks and pluses all over my page. But this wouldn't have happened unless I was, exposed and had language to speak to these things.
Absolutely, really good point. So both as our own, awareness and knowledge grows, and certainly also the passage of time. I've done this exercise, a couple different times in my life, and it did sometimes change.
I think one of the challenges I have with filling these out is these are things that I tell myself that feel really important to me, but I'm also a product of Teachers College, and so if anyone's ever taken Robert Carter's racial cultural lab, the question that comes up often is like, how do I affirm these identities? So it's one thing for me to say that I'm Mexican American, but how do I really affirm that? And so I always kind of give the example that I can walk around, for example, and say I'm the point guard for the LA Lakers. I can go around and say that it's really important to me. But how is that affirmed? Through my behaviors, through my actions. And so whenever I do these type of activities, I can't help but think of that question. And it kind of makes me nervous to think of the answers sometimes. And so while I can say all these things and it does create some anxiety about like whether there's any kind of validity to it. And something about saying, well, it's true for me and that should be enough. I want to say that, I want to believe that, but there's a skeptic in me that almost doesn't allow me to accept that.
Thank you. That's a really good point. I'm just wondering, how many other people felt any kind of anxiety while they were filling out this form? Yes. So I think that's, a really important point that it brings up those kinds of questions, and that you're doing it for you, for how you identify, but is that really enough? Other observations?
I would even add to that, speaking back to the idea that we'll ever become competent related to multiculturalism, particularly as it relates to supervision, is just how much guilt I felt immediately, because I just started filling it out at the same time that you guys were, about those identities that are not as salient for me. And really kind of getting stuck about like, well, why aren't they? And what does that say about me? And what am I doing about it? The ones that come to mind are ability status, and religion, spirituality. And there's other identities too that just I don't spend as much time or aren't part of this identity that I have, this professional identity. So there's a lot of guilt related to that. And I think it goes back to that idea that I feel like even though I know I'm never going to be culturally competent, that I really strive for it, and I really feel like, am I doing what I need to be doing?
I think related to that, when I was filling this out, one of the things that I looked at is it's very important influence on my beliefs, preferences, and behaviors. I don't think about it, it's not salient to me, is not the same thing as it's an important part of what I do. So I can say, for example, like, I don't think that much about my immigration status, but that's because I have privilege there.
Right, absolutely. I think, the question mark items can be, and that's why, that is one of the categories. It can potentially point to privilege if it's not something we've ever had to think about. Yeah. And I think, another point is also that this, you're doing this here at this conference, in your professional roles, and that our identities and how salient some of these are is going to shift with context. Like I might be more connected right now to my identity as a psychologist, and if I was in a setting where, you know, I was the only person of my immigration status or my race or ethnic identity, I might be a lot more aware of that aspect of my identity in that context. And so these are really going to shift kind of how important or salient they are depending on our situation, where we are. Other observations? So, you know, it's really complex. There's a lot of, you know, but what we really want one of the takeaways from this to be, other than, you know, just increasing all of our collective awareness about this, is that, you know, we bring this into our supervision, and then our trainees bring their diversity dimensions to supervision, and then our clients bring their diversity dimensions, you know, to the work. So, you know, so, I mean, first of all, that's like a little intimidating to think about everything that we have to consider as supervisors, and how many factors go into influencing that, but just that this is really complex and ever evolving, and so practicing ongoing awareness around it is really important.
One more piece to that. So in this idea of visible versus invisible identities, so I really resonate with what Rudy was saying, so that when, you know, there might be ways that we identify, and they're very real to us, especially in, you know, in our head, it's really important. But when we walk into a room, when we initiate that supervisor-supervisee relationship, or, you know, with our clients as well, what are they seeing, right? And so when I was at Teachers College, I swear this is, you know.
It's like a teachers' college reunion.
I worked in a Spanish-speaking community clinic setting that was in a hospital, within a hospital. And even though I very much identify as a Latina, and I identify as a working class, first generation, you know, and I can just go on and on about all these identities that I feel like I shared with my clients. When they saw me, they saw my skin color, they saw the way that I was dressed, they saw that I wore different shoes for different sessions, and that meant something to them. They saw, you know, they knew my title, they knew my role, they knew what university I went to, and that had a lot of meaning to them. So as much as I shared all these identities with my clients, you know, there's, you know, it really is about the visible versus invisible, and like Rudy said, how you actually live that out, and, you know, how that carries out.
And I'm just curious, before we move on, any thoughts? I mean, we're going to talk about this a little later, but while we're still on this, any thoughts about how, you know, how you do hold this as supervisors with, you know, talking about the trainees' identities and the clients' identities, and we might not always have access to all that information. But any thoughts about that? We're going to talk about it later, too. A lot of thoughts. I can tell you're all really deep in thought. I know it's after lunch. Okay, well, we're going to come back to that, but maybe just stick a pin in it. I think that's the first time I've ever said that. And we're going to come back to that. Okay. So a little bit, just backing up a little bit now. Let's see. So, what slide am I on? Okay, this is confusing. So supervision is everyone in here was supervised at some point, is being supervised right now. It's a mandatory part of training in mental health fields. Why is that? Any ideas? You spent hours and hours doing it.
Just really one word, but just the gatekeeping function of supervision?
Yes. Gatekeeping. Actually, that usually, sometimes nobody says that one, but yes, absolutely.
Just for teaching and training.
Yep. That's kind of the main function that we think about teaching and training.
I know there's like the apprenticeship sort of model as well.
Mm-hmm. Yep. Yes, it's used in mental health professions and all really closely associated fields, nursing, medicine. Yeah, I mean, really, all of the functions of it could be distilled, into these three, which you've touched on, and actually, the first one is the sort of ethical imperative that we have as supervisors, which is to safeguard the well-being of the public and the client. And so that's really, we serve a quality kind of function, and most of the time, when our work is really kind of fun and challenging and engaging, we're focusing on number 2, hopefully, which is promoting the trainee's competence. But, it is also safeguarding the well-being of the client and serving as gatekeepers for our profession so that we don't have, those who we might find unsuitable to be part of our profession entering our profession. So as part of that, cultural competence is also an ethical imperative. So, it's clearly articulated in the APA ethics codes. I think it's also articulated in ethics codes for social workers and MFTs. And we also know, which we'll talk about, that it is actually fundamental to successful clinical practice and supervision. But we want to go over a definition for cultural competence.
So supervision diversity competence is an incorporation of self-awareness by both supervisor and supervisee. It's an interactive process of the client or family, supervisee therapist, and supervisor, using all of their diversity factors. As we mentioned before, it entails awareness, knowledge, and appreciation of the interaction among the client's supervisee therapists and supervisors' assumptions, values, biases, expectations, and worldviews. And lastly, it's the integration and practice of appropriate, relevant, and sensitive assessment and intervention strategies and skills. That was a mouthful. And consideration of the larger milieu of history, society, and socio-political variables. Did you guys get all of that?
Yeah, those are my mentors, folks. This is how it is writing with them. No, so you can see that this is one definition. There are others. What they did with this definition is that they really did try to borrow from what a lot of the other definitions were and think about what it is as supervisors, what supervisors do that means that they're competent in this area. So you can see that it does touch on the awareness, knowledge, and skills, and also the relationship, and also some kind of value system is also part of that. Those are always harder for us to operationalize in our fields, but there is kind of a value system and a culture even, within the field of psychology, and just other mental health professions in general. So we know actually that when you survey mental health professionals, almost everyone says that they place a really high value on multicultural competence. So a vast majority of respondents will say that. It's like overwhelming. But then when we study it, we see that both there's a gap between perceived cultural competence and actual practice. And there's a gap even with having some knowledge of cultural competence and how to do that, and then enacting on that knowledge in our practice. So we all say, like, yes, this is good, we value it, we know it, and we go to these CEs, and then we go back to our offices, and independent raters sometimes, or our clients or our supervisees tend to rate us as not doing it as much as we think we're doing it. So, what's going on there? So, like I said, when they look at both supervisors and supervisees' responses, the supervisors rank themselves as higher on multicultural competence than their trainees do. And that's also, just so you know, true for just general supervision skills. That's not really fun to hear.
I can give an example as a
Yeah,
trainee. So I recall giving the feedback to a supervisor who was in a really high position that one of the things that was really hard to hold throughout, it was several months of supervision, and this was sort of an evaluation at the end, was the person in a really high position not acknowledging from the outset, like day one, what impact that would have, right, and the supervision process, and even just acknowledging, like, I know that outside of this room and outside of this supervision time, I'm also in this other position of power, and that has a lot of consequences and it has a lot of implications. And so not even just speaking to that, just that one sentence really made all the difference and kind of created a rupture and a tension and an awkwardness and a discomfort in the supervision process. So that was kind of a miss, and when I gave that feedback, that supervisor was really surprised and really upset because they were like, I consider myself a very competent supervisor, and I'm someone who's really aware of my power and privilege, and that was a major miss on my part. So that's just an example.
Ellie, it's almost like you knew what the presentation was and what my next slide is. So she did. So this is another really important thing to consider: power and privilege and supervision. I mean, first of all, so we talked about, so supervision is involuntary, it's mandatory, and that already can create a dynamic right there. And we know that trainees are acutely aware that they are being evaluated, and that that awareness influences their behavior in a lot of ways. I would love to spend like 8 hours talking about that, but I think you all know what I mean. So, supervisors can have a role in, first of all, just passing you from a training site and on to the next one. We write letters of recommendations. We, have connections. So it could also influence the trainee not just during the training period, but long after it's ended sometimes. So really being aware of that power and privilege that we have as supervisors. There's just this unavoidable power differential. And, in addition to that, this is not always true, but, the exercise we did earlier, supervisors may also identify or belong or have kind of a attributed identity or ascribed identity by the trainee for groups that are associated with more power and privilege. There's also a lot more data coming out about the real financial burdens on a lot of our students and trainees right now. Part of that is because of educational loans or having low or no stipend for some of their training sites. So, training there, that's also really stressful and something that trainees are thinking about a lot, and they might not just be thinking about how to get the most out of the training experience and learn as much as they can, but also I need to hurry up and get a job so that I can pay back all these loans. But I also want to point out when I say that that's not always true, And that can be also true for the supervisor. So the supervisor can also, the trainee can be related to certain identities or groups that are more associated with power and privilege. So I do want to put that out there, that, you know, a lot of supervisors also are in the same situation. Okay, anything more you want to say about that?
I can give other examples of how this might come into the supervision room. So, for example, as a trainee, I had to carpool, and so that meant that I couldn't stay after after hours to complete paperwork, and it really just limited what I could do and how I worked, right, within the scope of my limitations. I also lived at home with my mom and had to share a car with my partner. And, you know, there's just many ways in which those things impacted how I conducted my internship. And so that whenever there were any extra stressors, which actually I did experience, I had to really rethink what internship was for me, you know, whether that meant taking a leave of absence, shortening my work week, extending my internship year, and really kind of working with supervisors and having a relationship with a supervisor to be able to talk about all those issues so that they could really create a training program that worked for me.
So one thing I do want to point out is that, as you might imagine, that we just don't have a lot of literature, just in general, on multicultural and diversity issues, and, you know, somewhat true about supervision too, and then certainly on the overlap between the two. And I mean, I think that is changing, but that does kind of reflect what, you know, maybe we valued traditionally or historically as a field. And luckily there are some movements in that direction, but also because it's really hard to study in the ways that we want to. It's not clean, it's not easy to define things. It's and especially for supervision, one of the areas we have almost no data about is really directly linking what happens in supervision with the client's outcome. So, you know, we have treatment outcome and we have supervision in terms of outcome on the trainee, but we haven't done a good job of linking that to the actual client outcome. So that means that a lot of where our best practices and our guidelines come from, I mean, first of all, it means that we don't have as many of them as we would like. And also that, you know, our literature tends to point out the problem more, and then it tends to be more theoretical or based on our values as a field. So from the APA, you know, ethics principle and the APA cultural competence guidelines, that also, and supervision guidelines, and kind of bridging those all together. So I do just want to highlight that it is an area where we need more scholarship. And so, you know, we talked about the gap. So what happens in supervision as a result of this gap? So I think I'm like culturally competent, but not really competent, because you can never achieve that. But on my way, and my trainee is like, not really. So, you know, what we do know is that really a lack of cultural competence is going to have a negative impact on the supervisory alliance. We'll talk about that a little bit more in a bit, but the reverse is also true, that, I mean, we don't necessarily know the direction, but that we think that when trainees say that their supervisors are culturally competent, they also report the supervisory alliance as being stronger. It's also associated with more counterproductive events in supervisions, which are usually most, in the literature, those are mostly around ethical and legal issues, evaluation issues, and negative reactions to supervisors are the main three categories. We know that trainees often say that the burden of introducing these discussions falls to them. And we also know that there's less trainee disclosure in general in supervision, when trainees perceive that their supervisors are not culturally competent. And that's really important because, I don't know how many of you use things like audio and video review in your sites, but in a lot of sites, the main way that we know about anything happening in the room is through what our trainees disclose to us verbally in supervision. So if we have less trainee disclosure, that makes it really hard for us to really know where our trainees are and do our job as supervisors. I also want to point out that there is research that shows unique stressors on trainees that are cultural minorities. So there's research on microaggressions by supervisors, certainly stereotype threat, and so it's also something we just have to consider as supervisors when we know that our trainees might be cultural minorities, and even when we don't, because we don't always know all of their identities. So what does cultural competence look like in supervision? I'm going to first throw that out to you all, because I'm sure you already had some idea when you came in here today. You had to have some idea. I also don't want to be one of those people that makes people participate when they don't want to, because that's not culturally sensitive either.
I would say, first of all, to think about multicultural factors in the therapy that the supervisee is providing. So asking about identities of the client and how that might impact presenting concern and what healing or recovery looks like for that person.
Yes, thank you.
I would say curiosity. So curiosity about how these identities are salient for the person, how they're influencing what they do, what they see, how they interact with their client or with you in supervision. And I think not only does that kind of show curiosity and care for the person that you're supervising, but I think it also models that level of awareness and helps them to think about things. So if they haven't had that kind of curiosity about how one of their identities may be impacting how they're behaving or how the client is seeing them, it models that level of curiosity about the interaction and about themselves and their own, just fosters their awareness.
Absolutely.
Like Pauline said, the curiosity piece, but just asking, and to me that means taking a risk, because it might not actually be a cultural element. I might be missing something. So as a supervisor, or if I'm getting supervision or consultation, to take that risk of throwing it out there is important for me, rather than just kind of going with the bare minimum or getting the job done.
Right. Yes. Which might be tempting to do, because we all know we work at really busy places with acute clients, and it might, sometimes it could be something that falls to the wayside if we don't make sure it's front and center.
I guess for me, one thing, maybe this is just good clinical supervision, but just knowing that I'll probably get some things wrong, and just being willing to understand that that's going to be part of the process. So.
Yes, we're going to talk about that.
I think as a supervisor, also being transparent about some of the aspects of your identity that you bring into the room and the ways in which they could potentially affect the supervisory relationship is also important.
Yes. By show of hands, how many of you have incorporated something like that into your supervision practice? Okay. A lot of people have. Good. Ellie, do you want to say a little bit about what, from a trainee experience, what it can look like or not look like? Briefly, we'll talk about it a little more.
Yeah, I think you brought up the modeling piece, and I think that's so important. So, I think having the pressure of, you know, as a trainee to feel like I have to start the conversation or I have to have the identity conversation, you know, to really feel like I enter a supervisory relationship and I'm not the one that has to do that, right? That it's, you know, that really it's even set up that way so that the supervisor's like, this is who I am, this is how I work, these are the ways in which my identities impact how I work and even impact how I supervise. And then really that invites the conversation to begin with, but also I think a lot of you guys spoke to really focusing on the client and you know, as a trainee, hearing how my supervisor thinks about my client is really important, and thinking about how they think about the client in a diverse way, in a sensitive way that is thinking about the client's social identities and their context, is really important for me to feel safe to then talk about my own identities, but also it makes me feel like they're knowledgeable and that we're going to be serving the client the best way that we can, right? So modeling is really key.
Right, and I think that really, sorry, is there another comment here? Yeah, so that really speaks to, you know, sometimes we think, okay, well, is that all? Do I just have to introduce it and disclose things about myself and talk about the client? But just how actually that's a lot more rare than we would hope in supervision. And so, yeah, just by opening up that space, it is really important. There are also other things, but that's very necessary beginning.
I guess I have a lot of thoughts and a lot of questions.
Okay,
but one of the things that you just mentioned as a trainee and others did in terms of modeling that I was thinking about as we're sitting here is like part of the cultural awareness is remembering the power that you hold in the room as the supervisor and the evaluator. And I think something I've struggled with is sharing my perspective on clients sooner with my supervisees for fear that I'm holding a power of like maybe they'll defer to me, or maybe they will feel their opinions inferior, or maybe they won't share. And I'm hoping I don't build that type of relationship, but I think I'm so conscious of that I've actually been given feedback that they want more of my vision and viewpoint more often than I was giving. And so I think that's an interesting juxtaposition that we have to be aware of, is like how conscious of that we're being. And yeah, that's something I struggled with, so I don't know.
Right, I really like that point. It's also just a nice way to highlight just a lot of what can happen in supervision with all the different hats that we wear as supervisors and what that role entails, that there's a lot of that discussion back and forth. And it also could be a specific trainee's learning style, or, you know, I know that there are themes that I get as feedback about my supervision more consistently, so that it's, you know, more than one person telling me, so it's not just one person's learning style. But yeah, it's really important that there's a lot of, it's very fluid and there's a lot of back and forth.
I could share one more example, and my supervisor's in the room, so you know who you are. But one of the conversations that's really important as a trainee to hear is thinking about my supervisor as a trainee at one point, right? And so even just hearing about my own supervisor's training experience and talking about like, this is what it was like when I was a trainee, and I had a supervisor who did this, this, and that, and this is how I felt, and this is what I struggled with. And they really kind of normalized and validated a lot of my fears and anxieties, because they were so aware of my role as a trainee when they were really, you know, thinking about their own experience as a trainee. For some of them, that was not that long ago, and for others, it was a really long time ago, but they were so important. These relationships and these training experiences really, I mean, I really remember every single one, and it's not just because I'm still a student, because I've been a student for a very long time, but you know, they really are that memorable and important. And I remember the really good ones and the really bad ones.
Yes, and we do know that from the literature that actually how most of us, or a big factor of how most of us supervise, has to do with our own experience as trainees, both the negative and the positive, which is why we've also tried to get more specific guidelines because we really haven't had any until recently. But I mean, that's also always going to be part of it, and that's okay. But in some instances, we want a little more. So we are going to move into talking about some specific skills. And to start that, as I mentioned before, we do know that the supervisory alliance, or the relationship that forms in the dyad between a supervisor and a trainee, is one of the factors that's had kind of the strongest effect on outcomes and supervision. It's been the most widely studied. It's similar to the therapeutic alliance in treatment. So that's not so surprising. And so just to think about, really talking about what are the skills that are needed for that is beyond the scope of this talk, but just to point out some things, and some of you have already mentioned some of these characteristics that are, needed for also forming an alliance with clients. So we just know that things like warmth and empathy, somebody said curiosity, having an unjudgmental stance, respect, these are all really important for forming a supervisory alliance. And it's going to be more likely that a positive one forms when the supervisor has these characteristics. Transparency, sometimes in therapy, people have different kind of theoretical orientations about that one. It's more important in supervision because of the power differential that we're talking about. And I know that there are also some theoretical orientations that even in supervision don't like that as much, and sometimes there is validity to that, or there's something good to come out of that. But it is good to at least be transparent about your, evaluation methods and feedback and things along those lines. But I do always share that actually my very first training experience, I have some ambivalence about, giving a trainee the evaluation form right away and saying, here's what to expect, I do that. But that in my first training experience, nobody ever told me that I was going to be evaluated. I just had no idea. So all of a sudden they send an email and they're like, we're going to set up this meeting. And I got really scared all of a sudden. But I always say that to me, I think that was actually a really good thing because I wasn't thinking about that at all. I was just thinking about my own learning and growth. So I think otherwise it could have affected, how I was monitoring myself, but I was really just not concerned with that until I got the email. Okay, so also some behaviors. Some of these have come up too. These are just kind of generally good things to do. So encouraging developmentally appropriate autonomy, depending on where your trainee is, where their skills are, expressing trust in their abilities, providing both positive and constructive feedback. So a lot of supervisors are sometimes on one end of the spectrum or another. We know that it's usually more on the end of positive feedback. That might not be you, that's okay if it's not, but trainees do say that, but they say both. So there are some supervisors that give predominantly constructive feedback, and that could be problematic too because our trainees really need to know their strengths. Modeling clinical and supervisory skills, sharing expertise in the service of the trainee's growth. And it's also really important to repair any strains to the alliance. So it's not that we have to do this perfectly. It's a relationship between two people. It could be complicated. There are a lot of different dimensions of diversity, and strains will happen. It's really about how we repair them in attending to the alliance, especially at the beginning of the relationship and also when there are strains.
Just speak a little bit to the alliance, particularly with providing positive and constructive feedback. I feel like there is such a, it can really go both ways. So oftentimes supervisors will provide a lot of positive feedback, and trainees, depending on what their social identities are, if they're struggling with imposter syndrome, for example, and you're getting this tons and tons of positive feedback, but that alliance really isn't there and the trust in the supervisor's feedback, that positive feedback can actually backfire, right? Or even just a supervisor who really means it and really thinks, all these great things about you, not naming that you might be struggling with imposter syndrome and that it might be really difficult to take it feedback, right? So even just naming that process, that emotion, that feeling that's happening in the room, right? And on the other end, I've given feedback like, I got this great evaluation at the end, but in the beginning when I really needed it, I didn't get the positive feedback, So it really is about this, timing, about naming, what might be going on in the room when you do sense that a trainee might not be integrating some of the feedback that you're giving. Thinking about imposter syndrome, I'm really holding Dr. Nadal's keynote and his experience, that his struggle to still believe that he has accomplished all that he has, right, to this day, and how real that is. And so as a supervisor to really be able to have that conversation. So positive feedback can go both ways, and just understanding that, how complicated it is.
It's not easy. And okay, so that's just sort of general supervision competence, but it does, the alliance, but it does map onto the trainee's experience of us as culturally competent and facilitating cultural competence in our trainees. Some suggestions that are more specific to cultural competence. One of the first and most important is what we think of as meta-competence. So that's our own as supervisors practicing things like self-awareness, so knowing what our strengths are, what our limitations are, reflective practice, understanding our impact on others, our stimulus value, our own reactions to our trainees, to their clients, to the intersectionality of all the identities. And so this is something that is really important to do on an ongoing basis. And a term that's used in literature more now that's more favored than competence is adopting a position of cultural humility. So that's really recognizing that we're not going to know everything. Someone said that earlier. And also saying that to our trainees and saying that to ourselves, and that's okay, and really making a commitment. We have this value in the field on being lifelong learners and constantly improving. So it's really not so much about sharing all the knowledge that we know, but it really has a lot to do with our stance and with our own internal practice. Modeling, Ellie, you mentioned that. So modeling is one of the ways that we learn, and it is really important for us to use that in supervision and modeling our own, meta competence for our trainees is one of the ways that helps them also assimilate those same skills. And also openly acknowledging gaps in multicultural competence and discussing them with our trainees. So when we don't know something, when it's out of our kind of scope of knowledge or practice with a certain client, talking about that and figuring out together what can be done about it or how to remedy that. And facilitating a respectful dialogue around diversity, being really careful of our language. Again, we're not going to be perfect. We do have research that shows that supervisors commit microaggressions against their trainees, and we should, aim to always be working on that and using kind of more inclusive language, but we may fall short. And you want to say something about?
Sure. I always like to give the example of being in a training seminar about multiculturalism and having the facilitator call me by a different Latino last name, not my own, which is just one of the most common microaggressions against me. And so that not being named and not being acknowledged, and just how, just thinking about the setting, this is a multicultural seminar, and we had just done this amazing exercise that I thought was really effective. It was very emotional. And so how just that one moment kind of destroyed the whole seminar for me. You know, the fact that it was never acknowledged, that then the responsibility lied on me to bring it up and to say like, yeah, you called me Elizabeth Ramirez and my name is Elizabeth Hernandez and we've been working together for, you know, that kind of stuff. Just how important, you know, those, you know, being able to have those really difficult conversations, especially when you're supposed to, right? Like in a seminar, and not relying on your trainee, on your supervisee to bring it up, right? Being able to have such a good relationship that you're even able to acknowledge and realize like something just happened, right? And being able to talk about it.
Yeah, and I think an example from our own supervision, so, you know, Ellie did her dissertation on undocumented students, especially, you know, students, people who came here as children. And so that was an area of competence that she had that was, you know, much more vast than mine. And she was getting a lot of referrals. A lot of the cases we were following were undocumented students. And, you know, there was one case in particular where I think, you know, you came in with this question. I told you I'd keep it private, what happened in our supervision. But no, we talked about this example. So there was a really unique case where, you know, it was one of the only people in the country that we know of that's a medical student that's undocumented and had these really unique situations with advanced parole and other legal things. And, you know, Ellie came in, she was like, what do I do? Because we don't really know what's gonna happen, because this may change, you know, and this was an area she knew a lot more than I did. And I mean, for both of us, that there's nothing written on this, that, you know, we had access to some people who are experts in this that we had already consulted, and to just kind of be the fact that like we don't know, it's a gap in our field. It was, you know, it was a gap for me relative to Ellie's expertise, and so then how to work with that. You know, we've been talking about this, so really considering just all the different dimensions of diversity, if I haven't hit that point enough. Also naming the power differential is really important, and for me, I do that from the very beginning. You know, also considering any issues that are specific to the setting where you're working and its culture, and how that might influence trainees, and what's happening. You know, for our trainees this year, there's, you know, their transition in our center. There's also a political climate. You know, we're in a big campus in Southern California, so considering that. So I guess take just a moment. I'm not gonna make you share necessarily unless you want to, but really think about kind of your own style as a supervisor, and how many of these suggestions are already a strength for you, something that you do regularly, and what might you want to augment? Is there anything that you can add? You know, some people do say that they start out a supervisory relationship really kind of going through all their dimensions and disclosing those. For me, and I think that's absolutely fine. For me, I disclose some initially, and I do it first, just as a way to model. And I don't necessarily press my trainee to disclose everything, but I just introduce it as part of the initial conversation of getting to know one another. I don't think as you can see from these best practices, it's not about right or wrong. There are so many different ways that we can incorporate it. There are just some suggestions for what to infuse into your work. So, and every time I do this, you know, and every time I think about my supervision, I always, you know, think about some of what I might be leaving out, because it is hard to do this consistently. You know, most of us are in settings where we're doing so much as supervisors, and we have 1 hour to accomplish everything we need to do. So the laying the groundwork in the beginning is always really important, partly for that reason, so that it could be an ongoing dialogue. I do want to, by show of hands though, how many of you had supervisors who acknowledged knowledge gaps with you? Okay. Not that many, some. So I do think that that's just important to know, to note, and that is really important. It's part of practicing cultural humility, and it's also just kind of good ethical practice to say, like, you know, I might say to a trainee that, well, I'm not competent at supervising a case of anorexia or something like that. It's outside of my scope. You know, it's similar. Similarly, we need to do that with cultural competence. Okay. How are we doing on time? Okay, we're doing great on time. So what we'd really like to do is have an opportunity for everyone to practice this a little bit. Any questions before we do that? We'll also have a little bit of time at the end for any last questions. Okay. And I know it's Friday afternoon, and I'm going to make you do something active now a little bit. But, okay, we have one question. Some people are relieved. They got to put that off a little longer.
Sure. You've alluded to this quite a couple times throughout the presentation so far about how we have to be mindful of all these layers of culture and context and et cetera. I think one of the things that I constantly struggle with, though, is, you know, I have an awareness of the importance of engaging in these type of practices, but there isn't an environment, specifically like an institutional climate, where it's conducive to that kind of work. And so there's this frustration that I think that sometimes builds within me of sort of how to navigate that. And I don't know if you have an answer, that's fantastic, but I think that's one of the things that I constantly find myself frustrated about with these type of trainings and seminars is we talk about it, we all are in agreement with that, but the powers that be maybe don't care about this or do care about it, but there are other pressing matters. And so there's this kind of incongruent message or dissonance that I experience, and I don't know quite what to do with that. I just want to say, I mean, I completely resonate with everything you just said, and I feel that way all the time, and I feel that way when I present. Like, I'm acutely aware, okay, you know, we talk about this, but there are barriers. You know, some of it is us and within our power, and, you know, that's usually the part that these presentations focus on, including this one. And yes, I completely relate to that. I feel it even when I present, like, okay, but there are these barriers, very real in our settings to implementing them. I mean, I even remember we brought in a speaker to do like 2 days of CEs about both multicultural competence and supervision, and multicultural competence and supervision. And I mean, right away, I mean, there's so many issues with our center in how we do things. Like from the very moment that a student walks in, we have forms that are forced choice for them to identify their cultural identities. We don't ask about a lot of things. We don't ask about religion. There's all these things we don't even have a space for. You know, we don't have a space for someone to say they're undocumented. We don't have a space for someone to say if they have a military history. And that's done so that we can collect data and who's coming in. And I started at UCLA as an intern, and we had, you know, our diversity seminar, and right away, kind of all of us pointed that out, and the people who were heading the seminar were like, absolutely, we're going to take this to the administration. I'm like, how can we not have these? Why is everything forced choice? Like, people don't get to say how they identify. And I mean, you know, this is 5 years later and nothing. So I feel that frustration too.
I mean, I think we all have our own way that we manage them. I don't know that mine is the best. I mean, I am kind of more of a pain. I take every opportunity. Like, we recently had a CE on religion and spirituality, and afterwards I immediately sent an email saying, like, do you know what, we don't even have a way, you know, not that we can't ask our clients, but can do a little better. So that's my approach. I mean, I can't tell you it's been successful for everything, because, but I think, yeah, I think that is really challenging. And even, you know, we just did evaluations for our trainees at the end of the quarter, and, you know, my own trainee gave me feedback. They were like, you know, you do bring in some of the cultural things, but I just feel like there's not enough time.
I can speak to, if I can boldly try to give an answer, Rudy.
Please.
I would say that the supervisors that I have found the most effective were the ones who spoke about exactly that tension and that anxiety, and actually said, like, the system that we're in is not going to allow us to do what I believe in and what I value. Or these are the things that I am struggling with. So when I was Ayala's supervisee,
I never did that.
That was one of the
My boss
first
isn't in here,
conversations
right?
that I remember, like her going on a rant about the demographic form, and me feeling like, yes, I thought the same thing, but I didn't have the guts to say anything. And now that you said it, now I'm going to talk about it. Now we're going to talk about it. Another thing that supervisors have done with me to that effect were, you know, even just, you know, sometimes even going over the time that we have, even if obviously we have to think about self-care, and that's not always possible, but sometimes that also sent the message, like, you know, this is just so hard to wrap this up, and we went over, and you see, and we just had such a good conversation, or, you know, things like that. Those moments are everything, you know. But naming exactly what you just said in the supervision, and acknowledging the system that you're in and all the barriers and all the problems, so that the trainee who does probably recognize those things can also just feel safe in talking about them.
Right, and I think the opening session talk yesterday for me kind of galvanized that a bit, just that, yeah, sometimes, you know, kind of using our voice to do what we can, and that sometimes there are consequences to that. You know, there are consequences either way. So, yeah, I don't have the best answer for you. I wish I did. If you ever hear one, email me, please. Okay, oh, yes.
I'm like in the front row and obnoxiously talking a lot. I feel a similar frustration to you, though, as when we're modeling this and really working hard at doing something like this with everyone we interact with, regardless of client, supervisee, and then we're in a greater context, like maybe an all staff, or our supervisee is interacting with a colleague and they do experience a microaggression, or this isn't modeled by other staff who maybe aren't in the training program, or maybe even in the training program. And then I find myself, thankfully, to have a good enough relationship with supervisees to notice that and see that and be able to talk about it. But there's a struggle there to manage. This is often maybe sometimes people who are higher than me in the system. And then how do you talk about that with a supervisee and be real, but also be monitoring, like, this person has a level of power over me and over my supervisee. And so I don't want to ask you a question because that's probably really hard to answer, but how would you manage that, or if other people have managed that? Because that's where I feel a level of frustration with the system, is like, even just within the center, how do you deal with that?
Let's ask the audience. No, but serious. I think it's an important question. I don't know if anyone has, you know, encountered something like that or wants to share, or even someone in a position of power and more administrative position have suggestions. Mm-hmm.
You see something, and a trainee says something, see something, and there's an awkwardness. It doesn't necessarily take a whole lot of dialogue to acknowledge that, okay, I see that, you see that. Maybe we are not powerful enough to actually really
Yes, so just acknowledging that shared experience, even if you don't go more in depth.
I would like to be more daring and go more in depth, since a number of my colleagues are here.
All right, I think it's also worth acknowledging, I just remembered this is going to be online. No. No.
Something that I found really validating as a trainee was when there had been times when upper level people at the counseling center had committed microaggressions towards me, and I brought it up in supervision, and my supervisor was another woman of color. It was really validating to have her say, yeah, that's not okay, and I want to empower you, but I also want to help you, and so tell me, you're sharing this information with me. Would you like me to do something about it and to use my role of being empowered to talk to the people that did that? Or are you kind of letting it out because it feels like that would be helpful right now, but you don't want us to do anything about it? And that was really validating to know that she could do something for me, but she could also just respect that I might not feel comfortable with that. And at that counseling center, we had a multicultural workshop once a semester, and I remember feeling really validated when she had suggested, hey, let's have this multicultural diversity training focus on this issue, and it was the issue that had been happening to me, and so that was really validating that she gave me an option of we can do something, or you and I can talk about how you can move forward when things like that happen.
Absolutely, that's a really, really good example, and also something we know in the microaggression literature, even for our work with clients. Supervisors, I think, actually can maybe do something more directly than we can with clients, but kind of having that option. Is this something you want to address directly? Is this something you want to just share here?
I think Kevin Nadal actually also spoke to this. So I think, and this is just all of us have, this struggle, but it just takes one time that you spoke up about something and someone actually did something about it. Someone actually supported you someone in a position of power actually did speak up for you, and something actually did happen. It just takes that one time to feel empowered to do it again and again and again, and it really just snowballs. I have a great example. I had a very negative, really racially traumatic experience in an internship interview, and I shared it with folks I felt safe with sharing, and I just continued to share it, and people would ask me, they knew I was interviewing a lot, so they were like, how are you, how did it go? And I would be very honest about it. And it was just one person who I didn't know, was really connected and picked up the phone and reported it to APIC. And then I got a call from this committee that existed saying, well, what happened? And I want details. And, would you like to make a report? And yes, I do. And something actually happened. And so that was one time, and ever since then I have noticed myself feel more emboldened and just more comfortable in naming things that have happened and that I struggle with, knowing that maybe one day I'll find the right person will be able to do something about it, and so just to continue to speak up about it. So.
Right, and I guess the one thing I would add to all that's already been said is that, I do tend to kind of voice my opinion about some of these things, so then I feel more comfortable, being consistent with that in supervision. But, sometimes when I can. So because my, people that I work with and our directors know what I think about it already, so I felt fine. Apparently I went on a rant about it with Ellie, I can't remember that, but I probably felt just fine doing that because I had already gone on that rant to our leadership. So let's transition a little bit to just give you an opportunity to practice if you want. If you'd rather, stretch a little bit and just do your own reflection, that's okay. But, for me, the way that I learn is by doing. So I always think it's really important to after kind of thinking about this, to think about, okay, is there anything you want to do differently? Is there something you really want to emphasize from what you already do? So we want you to just maybe pair up with a neighbor, and spend a little time just doing a role play of yourself as a supervisor, regardless of whether or not you supervise. And just do kind of an initial meeting. So one of the early meetings, it doesn't have to be the first one. And think about if there's anything in how you introduce yourself and how you introduce the supervision experience. How do you start building the alliance? How do you infuse this discussion from the outset? What do you want to model? What might you want to disclose? What might you not want to disclose? And so we're going to give you some time, and we'll come around, and then we'll just touch base about it later. So we'll give you enough time so that both people get a chance to role play as the supervisor. If you haven't already switched and had a chance to be the supervisor, switch now or soon. Go ahead and take a couple more minutes. Okay. Let's bring everyone back. So briefly, we're going to have an assistant bringing around the microphone. Ellie needed help. So, and it's, part of metacompetence to know when you need help and get it. So we want to just, anything that you notice, because we do have a lot of, share collective wisdom in the room. So if there's anything that you felt like, I don't know, works particularly well for you, or that you really liked about what your neighbor did, anything that you want to share about that experience, or maybe you're even feeling pretty good, like, kind of got this down, I don't know why I went to the CE at the end of the day because I'm already doing all of this. Like, that's good to know too.
And you'll get to see his face up close.
Up here. Front.
It's really just so I can see Joaquin. Hi. I guess one thing that came up during the practice was, one thing I don't do is talk about necessarily my identity, especially in the first supervision. That feels a lot like turning the attention on me, and I don't know. I guess I'm struggling to think of it how to present that in a way that is about meeting my supervisee's needs and less about just talking about myself. I talk about my approach to supervision, my own approach to therapy, and how that influences supervision, and some of, I guess, my professional identity and how it shows up in supervision. But I don't start sharing kind of what my identity is, and I don't know whether that's something I should think about changing or not.
I mean, because it's Ellie and I doing the talk, I'll tell you kind of my own stance. I do know some people who might encourage you to share, but I personally don't think that there's necessarily a right and a wrong. For me, I share, and I share differently also with different trainees, and I have to say that part of that is influenced by maybe what their visible and invisible identities are, so what I might already see as a potential difference or similarity between us. And I personally don't share everything, but I do know people. I mean, I've gone to talks where I've heard, really important people who have written a lot about this say, like, this is what I do. I right away kind of disclose all of these 10 different factors or something like that about myself. So I personally don't think there's a right and wrong, and I actually tend to agree with you. I think about what is this in the service of. For me, early on, I'm trying to form a relationship. I'm also trying to model that discussion is welcome in supervision. I do tell trainees a little bit about myself and my background, and through that narrative, some of my identity dimensions do come up. And I don't force them to tell me their own, but I do that first because, I hope they will share what they feel comfortable in those first meetings. So that's my opinion. That's all that is.
One of the things that came up in our conversation was about how do we sort of put out there in the beginning about valuing each other's diversity and cultural identities, but also I think I was sharing how it's important to me to make it clear to my supervisee or trainee that that the conversation just can't end there, and how sometimes our identities or our desire to cling to these identities can block us from growth. And so I was sharing even in this discussion about how early on in graduate school I was very much proud of being a Chicano and Mexican, and how emotions were kind of BS, and that wasn't really valued, and that my supervisor wasn't appreciating my diversity. And their intervention was, that's BS, and you're being defensive. And I guess they had a little bit more weight because they also identified as Latina. And so I was like, oh man, like she can get away with sort of calling me out like that. But it was uncomfortable, but it was really pretty pivotal moment in my training of like, I have to take a look at that. I can't just get away with saying because I identify this way, that means that I don't have to be emotionally available to some of my clients who may need that.
Mm-hmm.
And so I try to make that clear to trainees who I'm just starting off having a relationship with, of like, yes, I will honor and value your identities, but I also will call them out if they come across as defensive. Like, you just can't say, this is how I identify, so I can't go there. That's not enough, and I hope that we can have sort of an open dialogue around these issues.
I really like that. I do something similar in my initial meetings of talking about kind of coming to have more insight or change something as a result of supervision. And I think that is important, rather than just being really dry and talking about, this is important, we're going to talk about this, and your worldview and identity are going to be part of it, and the clients and mine. Having an example is helpful.
I think from my experience as a trainee, and I learned something is, one thing is I always appreciate supervisor could be transparent, and also sometimes willing to do some self-disclosure, share the past experience, also struggle with similar things, make it more feeling there's knowing, okay, so it's not just my struggle, but supervisor also had this experience, so you feel like me being more understood. And another thing is being able to acknowledge trainees, how much risk they are taking when they challenge you with some question. I remember at one time I really challenged my supervisor, and it's really hard for me as someone grew up with my culture, which if you heard of ultimate teacher Confucius, in which he's really you don't challenge your evaluator, your teacher, and you don't really confront. I shared to a Chinese culture, Taiwanese culture, it's to in America, in the States, we would say no stupid question, no stupid question. But in Chinese culture, it's no stupid question. So it's really hard for someone with my background, growing up, to challenge the evaluator. But one time I really challenged my supervisor, and I said, I feel you simply don't like me. And being able to say that and being able to clarify the question, and while supervisor will now acknowledge wow, I appreciate that you are taking risk to ask me this question. I know it's really hard, considering your cultural background. And it's really helpful when you are being acknowledged and it's okay to do that.
Yes, I love that actually, because it also really acknowledges the power differential, and that, we do value in more Western cultures that, we ask our trainees for feedback. It's actually a competency that they're part of the supervision process, but how do we make space for that and also kind of honor where they are with that? Okay, one final thought, and then we'll wrap up so you all can get out of here.
So I haven't done this. I'm not quite a supervisor yet because I'm still a trainee, but to kind of answer your question about, how do you talk about yourself in that first session without, directing the attention back to you and making it about you. One thing I heard, which sounded amazing at another counseling center, is that they talk about how your supervision style and your therapeutic style is informed by your own identities. And I think that's such a wonderful thing of being able to say, this is how I do the work, but this is also who I am as a person, and this is how it kind of goes through with all of that. So it feels just this really insightful, brilliant thing that I want to eventually adopt when I am a supervisor, but just thought I would share that as a awesomeness.
Thank you. Okay, I'm aware of the time, and So, just to wrap up, I really want to just thank everyone for being here after lunch on a Friday, after 2 days with a lot of, sometimes kind of challenging discussions. I really appreciate it, and really appreciate everyone's, value on supervision and multicultural competence, because it's a really important thing that we do as professionals for, the next generations that come through in the field. So thank you very much. Thank you, Ellie.